This podcast is for entertainment purposes only and does not constitute professional advice. The views, thoughts, and opinions expressed are the speaker's own and do not represent the views, thoughts, and opinions of their affiliated organizations.
Hey everybody, welcome back to Ready to Connect. I'm Lisa.
I'm Heather.
And Ryan, where are you, Ryan?
We're missing our Ryan. He wasn't able to be here today, but we're missing our Ryan, and I'm sure you guys are too. But he'll be back soon, we promise.
Yeah. We're going to continue. This is the last of our series of interviews and stories with dynamic people today, and we have a chiropractor to interview for everybody there. But before we bring in our special guest, what happened with us this weekend? What you been up to?
Well, I got to spend the evening with my BFF over here. We went down to Pratt Street, or is it up, down? I don't know.
We went over to Harvard.
Over to Harvard, and partook in the Bridgerton ball experience.
Yeah. So the Pratt Street community there, all the businesses on Pratt Street, they have a type of association, and they put on the Bridgerton ball. And so the idea was to go to Pratt Street, which if any of you've been to Hartford, you know Pratt Street is for pedestrians only. There's no cars allowed through. And that street is lined with different restaurants and pubs.
Just absolutely enjoyed the restaurant we went to.
Yeah, we went to, it was Hartford Flavor Cocktail Parlor.
Yes.
Was the name of it.
But the best part was everything was gluten-free. And me being celiacs, it is so nice to go to a restaurant and not have to
worry about if you're going to have
get sick,
Plus, the food is really, really good. A lot of people think gluten-free or sometimes even vegan. They think gross and ick, but it was really good food and, really good cocktails. That's what they're known for.
Yes.
They have really great cocktails. And we were able to get a reservation for dinner before the whole Bridgerton ball experience was supposed to happen. So we were actually viewers of some of the stuff that happens before.
Yes, it was so nice to see just the diversity, the unity, and everybody actually dressing up at the part of the whole Netflix Bridgerton series. And I don't know, my favorite part was walking up to the table and getting a Lady Whistledown letter.
Yeah,
that's just so cool.
For those who maybe don't understand what Bridgerton's all about, it is a series, I think in its fourth season now.
Yes.
It plays on Netflix.
Yes.
And it's set during the era that, let's see, what would we put that?
I would say that's Edwardian, the Edwardian era.
Okay.
Yeah.
Where women couldn't go without a chaperone anywhere.
Yeah.
They would have balls so that women could then find their husband. And of course, you make a choice if you want to become a spinster or not. And so the whole series is just really wonderful to watch the fashion. We like to look at the fashion and see what they're wearing. And the music's really good for that show too, because they take contemporary music and they play it with strings, make it more old-fashioned.
And I thought that was lovely how Hartford Symphony partook in that, and they sent a few members to play that era style of music, but it was actually music you would hear on a regular radio turned into classical.
Yeah. It was really wonderful to have the Hartford Symphony there. And I think the idea of promenading, because that was a big thing back then, is you would promenade or walk to show off your wonderful fashion and to show that you're available, I guess. And so we did, Heather and I, we did go, and we did bring I brought my husband, you brought your boyfriend, and we dressed in our sundresses, but not dressed up in the ball gowns.
We were not dressed for the time period.
But I do promise if they do it again, which it seems like they will because they had such a great turnout for it.
Yes.
That they'll do it again, that we will
next time I'm going getting
full out.
Yes.
Full out.
Yes. And we didn't get to dance.
That was the one thing that I really wanted to do because they did have some people from the Arthur Murray studio to teach people how to do the dances of the time. And we were busy finishing up our dinner. I had thought by going to dinner like 45 minutes before the whole thing started that we would be able to at least be done. But we didn't get out there until closer to 7.
Yeah, well, I think it was really so popular, and
Yeah.
the restaurant was extremely business,
Busy.
busy, and yeah. And plus, let's not denote the fact that it was like 95 degrees out. So
Yeah. Yeah. So,
waltzing around Pratt Street was probably not on the high priority list.
but I do want to learn those dances. So I think next time when we do it next time, because there was so much drink and food offered by various vendors all down Pratt Street, up and
Yeah.
down Pratt Street, we probably could have gotten something to nosh on and to have for a drink without having to make reservations. It was really cool that they also had tables set up with card playing and dominoes, and they had an area for kids to play like yard games,
Yes.
which was cool. They also had the cigar station.
And even the kids were dressed up.
I know, so the kids were just
Oh my
dressed to the nines
gosh.
in the style.
It was so cute to see those two little boys that had like the long tailed jackets on.
Yeah.
I
I tell you,
Oh
the
my
men
gosh.
dressed to impress that showed up, that dressed up, they had their frills, they had it was just wonderful to see how many people of all ages
Yes.
that attended.
And
like
again-
I wasn't the old one there.
Right.
By far. So that was good. And it was just a lot of fun to see and watch. And next year we'll partake even more.
All I can say is Amazon was busy delivering Bridgerton clothing
Clothing,
to
yeah.
a lot of people.
I did ask a couple ladies where they got their dresses, and they all said Amazon. So I expected some of them to say, well, I belong to a theater company and I was able to get costuming or things like that, because some of it did look really authentic costuming. Like,
Yeah.
yeah.
But there is groups of people out there that this is what they do.
Yeah. So aside from the Bridgerton, for me, the rest of the weekend was spent basically in my reading chair or just trying to stay cool. Did you go kayaking this past weekend?
We did try to get out on the water. It was just so hot
Yeah.
and the air was so thick, and there's not enough lakes in this area where you can like butt up against some shade for a little while. So you're just basically floating around under the hot sun, and
Yeah.
I don't tan. I'm
Yeah. Yeah. We
it
just
wasn't my cup of tea.
We just smelt. But yeah, so like I said, this is the last of our series. We're going to be having next week, our next
We're gonna have a
podcast.
special guest.
We're gonna have another special guest, but she is special because she is a Patreon subscriber
Our Nancy.
who has subscribed to the tier where we are going to give her a tarot reading.
That you will all get to hear and witness.
And witness, we're going to film that one. So that one
Yes.
we'll have to make sure our hair is combed for that.
And then, drum roll,
We
right?
start the next series,
We start our next series.
which is going to be not haunted, cryptids across America.
Yes,
Yeah.
cryptics across America.
Cryptids
Cryptids?
or cryptid. Yeah, with an ID.
Yes.
Cryptid. Because cryptic would be like, yeah, cryptid across America. So all the weird kind of strange paranormal type of beasts and
Yes.
entities out there.
So we're throwing it out to our audience. If you know of a cryptic in your area, then please, or cryptid, sorry, I
Cryptid.
keep saying cryptic. Please email us, message us on Facebook. You can find Ready to Connect podcast on Facebook, Instagram, any platform.
Yeah, DM, message us or email us. We're ready to.
We'd love to hear your side of the cryptid story, and also maybe do some research so we can bring it to all our listeners and get the word out there.
And I just want to make note that this next topic of cryptids was what was voted on by our Patreon subscribers in a poll to be the next topic. So we look forward to bringing to that. All right, so let's call in our special guest. Today we have Dr. Richard Cutting from Cutting Edge Chiropractic, and welcome to our podcast, Dr. Cutting.
Hello, how are we today?
Fantastic.
I'm a little hot, not gonna lie, it's hot, and we've got the fire thing happening, the Canadian fires, so the smoky outside.
Have you been outside?
I've been joking all day. It's funny because, yeah, it's funny because we're supposed to be in this heat wave and we're supposed to be in the 90s, and the smog has actually played to our benefit where it's only like 85, right? So kept about 10 degrees away.
Yeah.
And the sun looks like a giant ball of orange up there. It's pretty bad.
It does, it does.
So I like to be fully transparent with our listeners. So Dr. Cutting happens to be my chiropractor, and Heather and I have both met met you before. You were part of the BNI group when I joined for our business, Serenity Grove, and that's how we initially met. And then when I needed help with my back and my hips, I sought you out for your services, and the rest is history, let's just say.
Absolutely. Well, it has been a decade, right? We've
I,
been here for a decade.
it's crazy. Yeah, we're going through that. I mean, it's hard to think. So I've been practicing since 2012 of all things, and I don't feel like I'm old enough to be practicing something for 14 years. But it happened. It snuck up on me, and here we are.
Here we are. And so tell us about your journey that brought you to becoming a chiropractor.
Well, honestly, if you talk to most chiropractors, the story starts out pretty much the same. I got hurt, but it starts before that. I actually went to school for engineering initially.
Oh, really?
And yeah, I was studying engineering, and I just wasn't happy in the field. I could do the numbers, I could do the math, but I'm too much of a people person, and I was sitting behind a computer crunching numbers, and I'm like, I can't do this for the rest of my life. And when you're thinking that at 18, all right, you got to get a change pretty quick.
Yeah.
So I had this shoulder injury from high school. I was a high school wrestler, and long story short, I had one surgery after another that failed, and the first person to help me was a chiropractor. And when I was in his office, I was actually going to engineering school, and I was just telling him, I'm not really happy. And he goes, you're very wellness minded. You should look into chiropractic. And after that, there were more signs than anything of being guided down the right path. So one of the cooler ones, or the simpler ones, was I was going to Logan, where I went to college. I was going to interview for the position, or for the school. And can we hear me still?
Yep.
Oh,
Keep
yeah.
going.
Oh, okay. Sorry about that.
Wait,
So
we love signs, so I'm really interested to hear what kind of signs you had. So keep going.
we got off the plane in St. Louis, and we look out. We're out there, and the first thing we see is this Bible passage on one of the billboards right in the airport, and it happened to be my grandmother's favorite Bible passage. So
Oh, wow.
literally seconds after we saw that, I get a phone call, and it was the school calling and saying, "Hey, pending your interview tomorrow, you've been fully accepted." So it was just cool to see something that my grandmother had, and my dad pointed out, "Hey, that's Grammy's favorite passage," and then getting accepted immediately afterwards was pretty cool, pretty powerful in that moment.
No coincidences, right?
Right, absolutely. So then, I went to school in St. Louis, and I'll be perfectly honest, I'm a product of New England, and I hated every minute of the Midwest.
No, oh no.
so now it has nothing to do with the people or anything along that nature, just more with the fact that I like my four seasons, and their summers last too long, their winters don't get cold enough, and I needed to get back. So while I was at school, I just said, "Hey, I better make the most of this," and I took every opportunity that I could and tried to fast track my way out as fast as I could as well. But then that led to some cool opportunities. Like I got to work in the OR in neurosurgery, and I got to train with some doctors that are renowned in the fact that I found this out when my daughter was born 3 years ago. One of the doctors that wrote the book on pediatric chiropractic is right here in Tallinn, Connecticut.
Oh, really?
And she's good friends with one of the people that I trained under, and she co-wrote the book with that. So it was really cool. I didn't realize I got to learn so much and do so many things just because I wanted to make the best out of a situation that I wasn't happy in. So it's just kind of always about trying to be open and learning and moving. That's my story. Hopefully it wasn't too all over the place, but that's how I
Oh,
got to where I am today.
Yeah.
that's fantastic. Like what an amazing journey, and just having the spiritual signs, even not even thinking spiritual at that point, you can look back at it and say, yeah, I'm in the right place at the right time, right?
Yeah.
I just want to back up a little bit for our listeners who might not even know what chiropractic care is all about. So could you just give a little quick, what do chiropractors do?
Hey everybody, love Ready to Connect. Become a Patreon supporter for $1 a month, and that'll earn you a shout out or a credit roll.
Love Ready to Connect? Why not support us with the Ready to Connect Enthusiast tier? For $5 a month, you get exclusive content as well as power of voting on our next topics, in addition to everything you would get as a Ready to Connect supporter.
If you love Ready to Connect and you want to become a Ready to Connect insider for $10 a month, in addition to everything that you'll get in the other two tiers, you will also get a chance to be a guest on our podcast. All tiers, no matter how you choose to support Ready to Connect, you will be getting the podcast episodes a day early.
Thanks for supporting us.
Well, chiropractors, they find and isolate immobilities in the body that are causing pain or some sort of impairment that's affecting the rest of the situation. So, Lisa, can we talk a little bit about some of your cases so I can correlate it with?
No, absolutely you can.
Okay.
Not a problem.
So, a lot of times we work in the gray. So you go to an MD, usually there's a cut and dry, like, hey, the bone's fractured or it's not. Hey, you have this diagnosis or you don't. But there's a good portion of the population that they maybe get somewhat better. They don't notice a change. And that's a lot of the times when the chiropractor works. When chiropractic was first founded, so the founder of it, he was a magnetic healer. And he was basically palpating one of his patients that was complaining he was deaf in one ear. And he found this bump. And when he pressed on the bump, he pushed really hard, and that was the first true cervical adjustment.
Okay.
That day, that patient got his hearing back in his ear.
Wow.
And yeah, so it's a pretty cool story. Now, a lot of the schools don't tell you the rest of the story. He ended up losing his hearing again, but when he got his adjustments, he would have some of it back. So it was really cool. So what this magnetic healer theorized was, hey, there's some sort of dis-ease on this nerve root. And when I pressed on the joint, I removed this dis-ease, this discomfort. And so a lot of chiropractors talk about how not only does the adjustment affect the body, but it also affects the nervous system, which it very much does. As time has gone on, his exact theory was disproven, but we have found that there's clinical benefits to treating the patient and mobilizing their segments. So the most concise and simple way that I explain this to my patients is I say, hey, when you start exercising, your blood chemistry gets better and everything else starts to get better. You start to feel better. This is no different. When we start inducing motion into the body, the proprioceptive nature, so proprioception is just joint play, joint mobility. It's how your body perceives motion. So when there is better motion, it actually nourishes the system. It stimulates and tells it to recreate, tells it to change, tells it to move. So that's where you get that added health benefit because the body is not perceiving that there's an injury to that area. I could digress a little too much, but I'll try and make it more simplistic since we only have a little bit of time. So when there is some sort of immobility or dis-ease, as the original chiropractors called it, they would say there was not enough light. So there was a subluxation, sub less lux light. So subluxation or subluxated vertebra. And they would treat that subluxated vertebra. What we found now is when something is immobile, or that subluxation that sometimes that will get classified at, it'll also be classified as, it causes the body to say, hey, we're sending inflammation to that area. The problem is the inflammation never really shuts off.
Okay.
So when the inflammation doesn't shut off, it starts to spill out into the other areas of the body. So cascading the effect going down the nerve roots. Again, painting a very simple picture for a very complex thing. So it's called volume transmission theory. Basically, the volume of the inflammatory markers spills out into the other areas. Just like if you have a cup of water and you fill it up too much, the water's going to spill out onto the table. There's nothing wrong with the cup or the table, but something needed to basically remove that water being poured into it, or the immobility that we're experiencing. So that's where a lot of people start noticing, hey, my back feels better and my sinuses cleared up. And we started draining sinuses, we started draining our sinuses. My gut feels better. Why? Well, there's less inflammation in the area. Simple concept that I like to overcomplicate with too many words.
Yeah, that's okay. We're following. We're following. I'm just thinking about my own cases, and like I'm just thinking about my own self when I was most recently into CU was for some neck burning and pain, but I also had very clogged ears. And not only were you able to work on unclogging the ears, but also the neck pain, all with like certain muscles in my jaw. It's all just connected, and it was just very fascinating to me what you were able to do. I never would have thought a chiropractor would be able to unclog my ears, put it that way.
Yeah, well, that's one of my more fun ones to show up. So that's where I talked about the draining of the sinuses. But
Yeah.
that one's pretty fun for me because, as I explained to you in the room, our eustachian tube drains down our throat. So if our neck muscles are tight, then they can essentially pinch off that eustachian tube, right?
Yeah,
It's no different than when you
like a crimp in a hose.
So yeah, it's really similar to like when you were a kid and you'd take your straw and you dip it into your Coke or your soda, and you put your finger over the top of the straw and you pull your straw out of the glass, and the soda would stay in the straw. Well, when you remove your finger, the soda drops right out. Honestly, it's no different. So when the muscles of your neck get tight, they pinch or occlude off the eustachian tube, so it doesn't allow that free flow of fluid. So all I do is loosen up those muscles, and all of a sudden the fluid can move a whole lot easier. And it's just a structural change or a biomechanical change in the body that allows it to repair itself.
I think you had to do that particular adjustment on me maybe twice, could have been three times, and then I didn't have an issue with it anymore. So two visits I think it took, and it was really very, very helpful because having clogged ears, feeling like you can't hear anything, it's not fun at all. But so now chiropractic is under the umbrella of holistic medicine, right? So you're looking at the whole person rather than just the issue, correct?
Yeah. Yep. Chiropractic is holistic. You know, one of the major things that you hear about is the power that made the body heals the body. So it is very much in that holistic realm.
Yeah. So I'm curious to know what other holistic modalities do you like to incorporate into your chiropractic medicine?
If you like what you're hearing and want to check out more podcasts from Artist Haven Media, or are interested in recording a podcast at our studio, find out more information by visiting our website at artisthavenmedia.com. So
If any.
I like, no, I do quite a few actually. One of my favorites is actually acupuncture. And the reason why I studied acupuncture is, quite frankly, I didn't understand it. And I come from a science background.
And so for me, I have to kind of learn things backwards and forwards. And even holistic medicine has a science to it and it has recreatable results. So it's one of those things that if it makes sense, I'll do it. So acupuncture is one of the biggest things. And when I went through the study of acupuncture, the funny thing is we still don't really know why it works. It works well. We know how how the systems work, the processes of how we diagnose, treat, and apply the function, but we're still kind of perplexed as to well why these points work. And it's just one of those things that's been researched for 2,000 years at this point in time. And it actually might even be older than 2,000 years. I could be wrong. Um, and I see vast benefits from just the incorporation of that added in with the chiropractic. There's a lot of nutrition that goes into it, and then also I do something called sacro-occipital technique. So when we
Sacro
were
what?
talking
Sacro
sacro
what?
sacro-occipital technique sounds fancier than it is. It
Certainly
basically
does.
means from
Wait,
the
has this ever been used on me?
yeah, so
It
so
has? Oh my
the
goodness.
cranial adjustments that I did on you, or the adjustments I did for your ears and neck, and like remember when I was pressing on your head and pushing in different spots. So what we're actually doing is those are known as the immovable joints, but surprise, surprise, they actually do move. There's an easy test, so if you ladies can see in the camera, but I'll verbalize it as well. If you put your hands on either side of your temple and close your eyes, then breathe on in. You'll actually feel that there's expansion there. And if you breathe through your nose, you'll notice that there's more expansion.
Yeah.
So you can,
Okay.
yeah,
Yeah.
yeah, you can actually test that too with more fine tools to see. And I couldn't tell you how many microns I used to back when I was in school, but how many microns the head actually grows. But your sinus cavities are filling up and then draining, filling up, draining. So there has to be expansion in there, and that expansion comes in the cranium. So sacro-occipital technique, it sounds fancier than it is, but let's just break it down. So the bottom of your spine is the sacrum, and then the occiput is the base or the back of your skull. Okay, so sacro-occipital just basically is a fancy way of saying from your head to your butt. And that's the technique that it treats, and it works
So
a lot with that spinal fluid flow.
it definitely
Um,
sounds better to say the sacral occipital, however you put it, adjustment than rather than say I need to do the head to butt adjustment to you.
right, right, right. Yeah. Well, that's the fancy thing about chiropractic. Nobody really knew how to name it, so they got to create all their names throughout, and it's it's a fun story. So.
So, so acupuncture is one thing, a holistic modality that you use in your office. Any others?
So we were going over the sacro-occipital, and then one of the things we like to use is, and I'm going to classify everything holistic as we're using the body's power to heal itself.
Okay.
And we use laser therapy. So laser therapy is really cool because it sends infrared light. So everybody's talking about infrared these days. Laser therapy was doing it before it was cool. And what it does is because it's a laser, it's attenuated light. It actually passes through the skin and it penetrates deeper than your typical infrared lights. So when you actually penetrate deeper into the skin, it goes into the cells as well. And what this light does is it hits your mitochondria, which everybody remembers that's the powerhouse of your cell, but it increases the oxygen absorption of the mitochondria. So when it does that, the mitochondria is able to increase the amount of ATP or power that the body's producing. That ATP is how we actually create our healing response. So I can find regions that need the laser. We can target an inflammatory response or target a increased oxygen absorption in that area, and it creates faster healing results. We had a professional fighter, and he happened to be a friend. So I said, hey, listen, I want to do this to you. He got pretty beat up, so he had bruises on both sides of his face. He won the fight, but he took his lumps. And I said, I would love to just see this in action. And we lasered one half of his face and left the other half alone. And we could see that the blood from the bruises and all that was resorbing significantly faster on the other side that we were using the laser than the side that we were just leaving alone.
Wow.
Yeah. I do have pictures of that. That was a very fun experiment, but there's another modality that we use. So most people are familiar with like the E-stim and ultrasound techniques, but my new favorite one that I really like to work with is shockwave technique. So shockwave is still based in triggering a healing response in the body. What's cool about it is it uses sound. Now we think of ultrasound when we think of sound, but this is more of a concussive blast, where an ultrasound is high frequency. We don't really hear it, and it's more of like a sonar. This is more of like the bashing of a drum. Okay, so it sends a concussive sound wave into the tissues. It goes through the skin in a transmedium membrane, usually like ultrasonic gel or aquasonic gel, and the sounds actually reverberate off of injured tissue. So the cool thing is the treatment is equally diagnostic as it is treatment. I can go through and I can scan, hey, I know your elbow hurts here, but let's look into your forearm. And when we look into the forearm, we start hitting a spot that reverberates into the elbow. What this concussive sound blast is actually doing is it's cavitating or collapsing the cells of the damaged tissue. So it can be scar tissue, it can be adhesion. So scar tissue is just something formed post-injury. Adhesion is formed like a repetition or a repetitive injury. So when it goes and reverberates off those adhesions, it collapses those cells, and when they collapse the cells, it triggers a stem cell response. So it uses your body's natural stem cells to start recreating the tissues that are in the area, which tend to be healthy tissues. So the fun thing about this is when we start treating somebody, the results continue to get better after treatment. And the more I treat with people, so I'm having people that have been in for over, I treated them over a year ago, and they said, as I walked away from this, I just continually got better and better and better, which is what we all want. And it's really just targeting a stem cell response without using any injections, without using anything crazy. We're just using the body's natural systems and sound of all things. So it's pretty fun.
Sound, because both Heather and I, we use sound healing with our Reiki. We use the Tibetan bowls and the vibration from that, and it's very similar.
So it's probably using a Tibetan bowl, even depending on what size the bowl is, it's probably less force than what you're using, but the precepts and the concepts around the Tibetan bowls is the singing, goes into the cellular level and it starts recoding, and the vibration of that bowl is doing the same thing what you're talking about. So you have ancient history and now you have modern history matching up.
Modern science,
Science matching up. That's really incredible. I want to come and try that actually.
Well, I mean, if I remember correctly, harmonic resonance is huge in sound healing, correct?
Yeah.
So this is basically going way past that harmonic resonance and shattering it. But still, it's cool because it's based off of the history. Like, we know if we trigger the cell at some resonant frequency, it's going to respond. So when we break it, it still responds. We are lucky to have the bodies we have because it'll try and figure out every problem that we throw at it. So it's cool.
I think people don't really understand that their body is meant to be able to heal itself. It's meant to be this healing machine for themselves. And I think all too often people rely on pharmaceuticals to take care of that for them, not really understanding that our bodies can do a lot of that with help.
Yeah.
I think the problem in a lot of times too is they want the instant fix, where something like what Dr. Cutting's offering and what we offer, it takes longer. And some people have learned through society that, I don't need to cook the chicken on Sunday anymore. I can go buy a rotisserie chicken, right? Like,
Yep.
we can go and just get an instantaneous fix, where what you're saying and what we're talking about, it takes a little longer, but the body will respond.
Yeah, but even like what Dr. Cutting is using with that, the sonic blast that you talked about, that is actually taking care of the problem at its root. It's not
Yeah.
just taking care of the symptom. And I think so many of us out there in the modern Western world, we go and treat the symptom, but not the actual cause.
Yeah.
And that's the great thing about holistic medicine. You're looking for the whole person and what is the actual cause and going right there. And it can get messy before it gets better. In fact, I think when I first did the consultation in your office, even though I knew you already, you made a point of telling me that, with chiropractic care, things might get messier before they get better for you. And I think that's just something people need to understand, that when you go through holistic medicine or actually any kind of healing, it's like unpacking the closet that needs to be cleaned out. You're going to make a mess before you can put it all back together neatly.
Well, and the fun thing for me is people already know those concepts, and the thing that I actually use the most in analogies is dentistry. It's like, when have you gone to the dentist and you had an injury and you walked away the next day and felt better? Like it's just, it's not there. Like it hurts, but they are helping you. They're fixing you. It's the same thing. You have an injury in your body. I have to poke at it, and when I poke at it, it's gonna piss it off. That's the easiest explanation.
Yeah.
And the cool thing is, what people don't realize is the body being angry and hurt is how it's healing itself. It's equally a protective mechanism, and it's the healing response. So inflammation has been thought out to be this bad thing. And even in with me talking about volume transmission, my whole diatribe, we demonize inflammation. Well, inflammation is how the body sends the markers to heal, to correct. So, and pain also tells us, hey, this isn't a process of healing. We just need to get it to that point in time where it stops and where you are healed. And when we talk about the simple fix, I mean, people get stuck in their rhythms, their routine every single day. And if you do the same thing 30 times over, you have to do the same thing to counteract it equally as many times. And that's the not so simple fix. It's hard to undo what you've done all day.
Yeah. Yeah. So, I also want to talk about one thing that you have in your office that I really appreciate, is that you incorporate the massage part to chiropractic in your office. Like, when I go to see you, I know that I'm going to be spending a little bit of time with one of your massage therapists right out the back end. Can you explain a little bit why you do that?
Yeah. So, some chiropractors have massage therapists work the tissues beforehand. That concept never really made sense to me. So, Lisa, when you come into my office, I have the therapist work afterwards. And the initial idea is, hey, I can calm these tissues down. I can make this looser so I can adjust the person. That's where my hang up was. I could always get the person to adjust, or I could calm the tissues down to adjust them. But then the tissues in and of themselves are in a spasm state. So what we see in our office is, after the adjustment, if we calm those muscles down, people hold the adjustment longer, people respond better and quicker. So why wouldn't we do that? And again, it makes sense. The joint is moving appropriately now. Let's treat the tissue now, because the muscle can move appropriately now that the joint can move appropriately.
Yeah. Yeah. Another question: what are some misconceptions about chiropractic medicine you've come across that you've had to kind of correct in people's thought process?
The biggest one I hear is, once you start, you can't stop. And that's really
I've heard that too. I said, oh, okay, I'm starting with Dr. Cutting. I'll have to see Dr. Cutting until I die. Was actually, people have told me that. Yeah.
Yeah, it's not true. I'm going to use a dental analogy again because they're the easiest for us to see. Like, hey, you go to a dental cleaning and you brush your teeth all the time and you go back again. I've never once gone there and not had plaque. You still have those repetitive motions that you're doing. So what people tend to see is, hey, I'm feeling so good. They stop coming in and you fall back into your old habits. When you fall back into your old habits, everything goes back to where it was. You don't continue with the exercises, you don't continue with the strengthening, and something, you already have a proclivity to that injury, you're going to lean towards it. So what people really are seeing is the same thing as when you start exercising, you feel great, and then you stop and you don't feel great. Well, when you go to the chiropractor, you feel better. When you stop, it's not that like you're regressing, it's just you're noticing the changes in your body. You're noticing that these joints didn't move the way they were before. So it's not like you have to. You're not going to fall apart if you don't come to me. You just notice that change. You no different than with a massage. You notice that you were tight and then you loosened up afterwards. It's the same as any field.
Yeah. I think also what you helped me to understand too, because I would go in and say, I need everything to be cracked, and you're not actually cracking anything, right? The popping that you hear, it's not a crack.
Yeah. So in chiropractic, we joke, we say, don't be addicted to the crack. And and you've heard me say, oh well, we want to worry about the movement of the joint. So the crack is very simply put, our joint facets line up smoothly. So I always tell people, picture two suction cups. When you put two suction cups together and you stick them together hard and you pull them apart, they make that popping noise. The same thing in our joints, because there's that smooth facet, they seal up when they're not moving. Why do they seal up? Well, our body is a negative pressure system. So all that means is it gets pulled together. And when it gets pulled together, we've all heard of synovial fluid nourishing the joints, but when it breaks down into nitrogenous gas or nitrogen gas. And that forms that little bubble that when I move the joint, it goes, pops.
There you go. Yeah. Yeah. I've heard all kinds of crazy things about chiropractors and stuff like that. And some of it's just kind of too silly,
Yeah, I love them all because it gives me a chance to communicate with my patient and maybe learn something that I might not have thought about beforehand. You know, one of the things in healing is you have to realize your ego is not a part of it. And you learn that pretty quick because you're not going to help every single person. Not every person responds exactly the way you think they should.
Right.
And once your ego's out of it, people can tell you all these things and you can just laugh and you say, there's some truth to that, or there isn't, and you move forward.
Yeah. Yeah. Yeah.
So just to make a bad joke here, as we get older, when we get out of bed and our bodies are making different noises every day, that's just gas.
I mean, I can't attest to everybody, but yeah.
I swear I hear that all the time, like, oh my gosh, my body made a new noise.
Yeah.
Well, there's difference from snapping and popping, but we'll talk about that later. I don't want to digress too much.
So, what is exciting and motivating for you in this field currently?
Yeah, I've really been enjoying the shockwave again, but my favorite thing is actually communicating with my patients. I love to answer the questions. I love to talk about them because it's something that we all don't realize because we go through our daily life and what we do day to day is our normal. So we expect everybody to have the same knowledge, and it takes a little bit to realize, oh, I need to explain what I'm doing and why I'm doing, because this person doesn't have the knowledge base. Even though they're intelligent, they might not know my field. And that's where, the Latin term for doctor is teacher, right? So you have to teach, you have to educate, and communicating with the patient is really one of my more fun things to do. The other thing that excites me is no two patients really show up with the same case. So the body is a puzzle. I like figuring out the puzzle. No two people get the same treatment either. And when you have a different ailment, we move and we change treatment and we find out what you need. There's no real boring case for me. It's more piecing the puzzles together and explaining it to the patient and telling them, hey, this is what's going on. And then I really like when the patient understands what I'm saying and why I'm saying it, because then we just all move and work better together as a team. It's great.
That's actually something I really do enjoy when I'm visiting you, and if there's something new going on with my body and you can pinpoint the problem, you take the time to explain, even with charts. Sometimes you take out your marker and draw for me what's going on in my body and how you're going to fix it, or at least attempt to fix me. I mean, we've already heard how you've adjusted my head, so yep, this ditzy blonde head or head. You know what I want to ask you about, and this is really kind of far out there in left field. You talked about pediatric chiropractic. Do you have children that come to see you?
I do. And so this is funny. The reason why I learned about learned that my teacher worked with Sharon Valone as the chiropractor in town. She's since retired. Um, but long story short, I don't like adjusting kids. Not in the fact that like I can't do it. It's more you see how I can communicate with you and I can say, "Hey, this is going to hurt." If I say that to a kid, that scares the ever living crap out of them.
Yeah.
I don't have that nature of I like to know where my strengths and my weaknesses are. I don't have the nature of calming a kid down in my office. I can do it at home all day long, but in my office, it just I've never been able to do it. But that being said, there are pediatric chiropractors out there. Kids don't get treated the same way adults do. Their joints are very malleable.
That's what my question. How they must be different, right? Because
Yeah. And, if somebody's out there, really look into somebody who's pediatric certified. Because there's a lot of chiropractors that don't know their strengths and don't know their weaknesses. And somebody who's pediatric certified is just going to take a little bit more care with your child. They're going to learn a lot more techniques, and it's not going to be heavy-handed. It's really gentle. I mean, my daughter alone, she was having issues. She was having issues pooping. I can use formal terms, but she was having issues pooping. So one of the techniques that I learned at school is Logan Basic. And what that does is it releases one of the ligaments right in the pelvis. There's no like hard adjustment. You're just really pressing on a ligament and waiting till it relaxes. And it's almost instantaneous when they start pooping, enough to the point where when I was going to daycare, they would have me press my daughter's quote unquote poop button to make sure that she pooped. And then I started getting kids and I was like, all right, I don't want more kids. So I sent them all to my friend down the street, but I was getting all these constipated kids. So
okay, so now all the moms out there and grandmas, that includes me, want to know where's that poop button?
Well, so there's a reason why you've never received this technique. So it is. It's
you don't need to tell us.
Oh no!
Like
No! It's about an inch superior, so towards your head, and an inch to the right of your rectum. So you actually go and you press that, and there's the sacrococcygeal ligament right in there. So my school is the only school that teaches that, and you have to use your thumb. So we are known as the Logan Brown thumbs.
Oh, geez.
Yeah, but no, it really does work. It's just another thing that I didn't want to do every day for the rest of my life.
Yeah.
So I learned as many techniques as I could.
That's just too funny.
Understandably.
That's really funny. All right. All right. So let's say someone's out there. Oh, another thing I wanted to ask you about, and I just saw this recently. Do you know anything about this? There's chiropractic care for animals?
Yeah. Oh yeah. I have
Like you
plenty
bring
of
your
colleagues.
dog to the chiropractor?
Yeah.
Really?
So So yeah, there are animal chiropractors, and
Yeah.
again, here's what I would say: make sure that you go with somebody that's certified, because different dog breeds have different amounts of vertebra, different animals have different amounts of vertebra. Sure, we have palpatory exams, but uh, I mean, when I was shadowing throughout school, I saw some guys that claimed to know what they were doing, and then I took some classes on animal chiropractic, and I was like, these guys, they were just pulling it out of their ass. Excuse me. They were just winging it as they go. If they need to edit that out. Um, but yeah, there's animal chiropractic. So you remember my dog Rocky? That's how we met. When he was older, I had an animal chiropractor come adjust him. Again, it's about knowing your limitations, and I wasn't gonna sit there and pretend to know what his body needed. I had somebody come in, adjust him, treat him, and he did better. Uh, and there are specific schools for it. In the state of Connecticut, I believe I can practice it, but I have to be in the presence of a vet. Um, so
A
that's
veterinary doctor.
a veterinary doctor. So what ends up happening is a lot of veterinary doctors go to school to get their chiropractic degree. So like the biggest one, the most famous one is equine. Equine chiropractors are huge, and you talk to any horse person that has done it, and they'll say, "Oh yeah, there's a huge change. There's a noticeable difference in the horse afterwards."
Immediate.
But I mean, like,
I've seen
I'm just knowing how, like, you adjust me and things like that. I mean, do you get these popping sounds on animals?
yeah.
Yeah?
heard it.
Yeah, I've never heard them on a horse because I've never been brave enough to try and adjust a horse. But when I was doing like the animal chiropractic classes, yeah. So one of the reasons why I also didn't adjust Rocky because he was my test subject in school. So when I was doing that, he got the really bad version of my adjustments. But yeah, you could actually hear the cavitations, and it's cool. I mean, it's the same exact thing. It's just those joints stop moving and the two suction cups that stick together.
Yeah, I just, I guess I've just never seen that, like that sign hung out on a building, animal chiropractic. So,
So
yeah.
Well,
one
you
of my
do a
one of
lot.
my professors, he was, I like to describe him as Dumbledore. I mean, the beard, the hair, everything. Um, but he literally grew up on the campus. He went out, had a life, and came back to the campus. And he just knows everything there is to know about chiropractic. But my point is, he actually would even adjust snakes, which, I mean, that thing is all vertebra. So,
What do you whip it around? I mean, you just,
eh, you know, eh, I I never knew how he knew what he was doing, but he would show us again. He was Dumbledore. He would show us the snake, and he'd say, "See how it's not moving in this S-like pattern? There's a restriction right there." And he'd go and challenge the restriction, and then sure enough, the snake would start moving more in an even pattern.
oh, wow. I would not even the snakes are one of my things. Just no.
You're not going to be a
But
snake
I could
charmer
never-
in your next life.
I will not touch one. So I couldn't get close enough to it. I'd be on the other side. But yeah. So you say you don't like to push the poop button on the babies or do the animals. So do you have a certain niche for cutting edge? A certain type of client you are really great with that you're known for?
So I really like anywhere so right now my active patient basis is I have a 6-month-old all the way up to a 103-year-old.
Ooh,
Obviously
whoa.
I don't yeah. I don't prefer the kids for the whole thing where I told you my joy is patient communication, and it's hard for me to communicate with them. But I really like the person that's stuck in their day-to-day rut, and you don't necessarily need to be hurt. You just need to start somewhere. And we're really good at getting you started and getting you back to where you feel like, hey, I can move again. Maybe I can start doing these next steps to move forward. And that's what I like. We treat athletes at this point in time. Athletes are fun for me, but my big niche is the general public, the people that they don't think that they can do it anymore. And we can just say, hey, your joints are there. They can still move. We can still get you moving. We can still get you to enjoy your life. And I mean, even the tagline in my office is because quality of life means everything. And that's really it. With anybody that's suffering in their quality of life at some point in time, we can help.
I completely understand that. Do you have any advice you can give to anyone looking to get into this field?
Yeah, open mind and absorb as much as you can. There's things, we talked about how I was in the science background, and there's things that I see regularly that we can't explain, and it it doesn't mean that it doesn't mean it's not recreatable. It doesn't mean that you're not creating that change. The biggest one that I always tell people is uh I don't get it. I don't know why, but I have you heard of the ivory soap for restless leg syndrome in the underneath your sheets?
I've not heard that one.
No.
Okay, yeah. Yeah, so I can't explain it. I have an open mind. One of my old professors told me, "Hey, somebody with restless leg or cramping legs in the middle of the night, take a bar of ivory soap, put it under the sheet." I have more than 60% of patients come back and say my leg stopped. Is it a placebo? I don't know. I can't explain it, but that's what I say. Open mind. Not everything in this world is open and shut, black and white. And, the more you learn, the more you are open to it, the more you know that, hey, listen, experience is more important than what that book has to say sometimes. That's worth its weight in gold.
Absolutely, because
Yeah.
I would have said take more magnesium.
Yeah. Yeah.
I gotta try because sometimes I do get the cramping, the leg cramping. I gotta
Yeah.
try a bar of
I
soap
think
under
we
my
were
shirt.
actually talking about that the
We
other
were,
day.
yeah, we were. Well, that's one of the things I do appreciate about you, Dr. Cutting, is your open mind, because you certainly have been shown a lot of respect to what Heather and I do, our Reiki and our intuitive abilities and things like that. And I think it's because you have an open mind. And I think even with the acupuncture, you understand energy of the body and energy healing. It's all kind of together in one. So yeah,
Yeah.
appreciate that.
Well, and even the fun thing that about the acupuncture, and I said, like, we can actually find these meridians with electrical components. So they're there just because we don't understand them, but we know that we can poke at them and affect something. All right, so we know they're there. We just don't know everything about them. We have a good understanding, but we don't know exactly why. And sometimes we don't need to know the exact why. That's the innate nature of our life, right?
Yeah,
Yeah.
yeah. All right. So, can you tell people a little bit about if they were looking to become a patient of chiropractic care?
Are you taking patients?
Are you taking,
Yeah.
cutting
Yeah,
it? Any advice to new potential clients too for this type of care?
Yeah. So what I actually is, so first off, we're Cutting Edge Chiropractic in Tallinn, Connecticut. Our website's Cutting Edge Chiro, CHIRO.com. You can call us or text us at 860-454-0942. And the thing I'd say is the more you tell your doctor, the better they can help you. So I like it when somebody comes in and they tell me all of their fears up front, because we can address each and every single one of them. I never want to diminish any of your fears. I want to say, no, that's reasonable, but let's see why. Let's see why that's not going to happen, or let me explain what's happening in this scenario. And a lot of the times, people say, "Oh, that makes sense," and once it makes sense, it's not unknown and it's not scary anymore. So if you're going in, tell your doctor everything. They're there for that. They're there to hear it. So if you withhold anything, they're not giving you the best treatment that they could.
Yeah, yeah.
That's great advice.
That's really good advice. And so I really do hope that if you are a listener and you're having issues and maybe you can't figure out what's going on or your doctor can't figure out, give Cutting Edge a try. They certainly have helped me when I had, I think I started with you with hip pain, right? Hip pain.
Yeah.
I think so.
That we were trying to figure out. And I even went to a back doctor and
You had pulled the ligament in your leg.
or something, I don't know. It was something. Well, there were a lot of restrictions or something going on. There was just a lot of stuff going on. We don't need to bore our listeners, but before we say goodbye to you, we do something here on Ready to Connect. We pull an affirmation and we read it. So we have an affirmation. Do you want to read it?
Yeah, sure.
We have an affirmation. Let's see how it goes.
The affirmation is, your present circumstances don't determine where you can go. They merely determine where you start.
That's great.
And I think that's really good. That actually applies because, like you were saying before, just because your joints might not work for you now doesn't mean we'll take you there, and we'll make sure you can get farther. So we want to thank you for being with us, Dr. Cutting.
Yeah.
Truly enough.
Thank you.
And for our listeners out there, we look forward to being in your ears next week when we have our special
Live tarot taping.
filming of our Patreon subscriber, our lucky Patreon subscriber. So until then, get ready to connect.
Thank you for tuning in to Ready to Connect. If you're interested in exclusive behind-the-scenes content, be sure to like, share, and follow us on social media by searching for Ready to Connect Podcast on Facebook, Instagram, TikTok, and YouTube. And for those looking to further support our podcast, consider subscribing to our Patreon at patreon.com/readytoconnectpodcast. And until next time, get ready to connect.